At VPNG NCLEX Academy, we have analyzed thousands of NCLEX question banks, and we are bringing you what you should know. We run an NCLEX Academy, so by analyzing these questions, we know best how to direct our students and how to structure our lectures so we can cover a whole lot of points within a short time. And if you're searching for how to study for NCLEX in 2026, I will tell you, you do not need more random tips. You need patterns. The blueprint is very clear. NCLEX is testing decision patterns, not how much you can memorize. So students who fail usually study a lot of content, but then students who study patterns have more chances at success, because sometimes even if you're unsure, understanding the pattern helps direct you to identify the correct answer in any scenario. So right about now, I'm going to break down 7 recurring patterns that show up time and again, so you start preparing strategically. First, what is NCLEX testing in 2026? The focus is on nurses who can prioritize, basically prioritization, safety, delegation, pharmacological risk, clinical decision-making under pressure, and NGN case-based reasoning. We already have a video where we discuss what NGN means. You might want to look out for that. So the exam is not asking you what you know. The exam is asking, what would you do first? And that distinction changes how you study. So while NCLEX is a national exam for United States, testing, most school exams will test your ability to recall facts. But now NCLEX in 2026 is measuring your ability to make safe and effective decisions in a high-stake medical environment. So straight to the point, 7 patterns that appear time and again in NCLEX questions. First things first, oxygen wins. If airway breathing oxygenation is involved, it is almost always the priority across systems, whether COPD exacerbation, opioid overdose, asthma, post-op respiratory depression, anaphylaxis. Just note that if oxygenation is compromised, nothing else matters. So when you practice question banks, you need to label your scenarios or STEM. You ask yourself, is oxygen involved? By this single adjustment, you can improve your prioritization accuracy dramatically. Second one, acute will always beat chronic. If NCLEX presents 2 patients before you and one has a chronic but stable disease and one has a sudden change, whatever change that's happened or occurred suddenly should be prioritized. Okay, for instance, controlled diabetes and versus blood glucose of 40, or chronic pain versus a new chest pain. Acute, unexpected, new onset symptoms are almost always priority. So when studying, stop putting most of your attention in memorizing diseases. You need to start focusing on identifying instability. The third pattern we'll discuss today is that safety over comfort. This appears in nearly every system. NCLEX really rewards comfort-based answers if safety is at risk. I do think this is a pretty easy pattern to understand because it's basically common sense. So example, you need to elevating the head of the bed before giving pain meds, or verifying placement before feeding tube use, or checking labs before administering high-risk medication. So students often pick what sounds the most caring, but the correct answer is what prevents harm. The fourth pattern, you need to assess before you act, unless in situations where there's threat to life. A huge percentage of wrong answers happen here. NCLEX loves options that jump straight into intervention, but usually your correct first step is assessment. But there are some exceptions to this rule. If there is no pulse, no breathing, severe anaphylaxis, active seizure without airway, then you need to jump into action. In this case, you assess, analyze, or in any other case, you assess, analyze, and then you act. So when you're doing practice questions, you need to ask yourself, do I have enough data yet? Because you need to assess before jumping into intervention. The fifth pattern we're going to discuss is lab value triggers. Certain lab abnormalities show up repeatedly as red flags. For instance, potassium extremes, magnesium toxicity, low glucose, elevated INR, elevated creatinine before medication administration. Pharmacology questions frequently hide the answer inside lab interpretation. So instead of memorizing so many drugs, you need to study what makes a medication unsafe to give and focus on applying that in selecting your correct options. The sixth pattern we'll discuss today is delegation and scope. Many students overcomplicate delegation questions. Certain themes are recurring. For instance, for stable, predictable patients, you can delegate. For new or unstable patients, that is strictly RN responsibility. Teaching and assessment is also strictly RN responsibility. But if you see something like data collection, you can delegate that. And this pattern is consistent across hundreds of questions. If the situation involves judgment or evaluation, it needs to stay with the nurse. Otherwise, and in cases where patient is stable, it can be delegated. The seventh and final pattern is NGN clinical judgment logic. Next gen NCLEX questions follow a very structured reasoning path. You need to recognize cues, you need to analyze the cues, you need to prioritize your hypotheses, then generate solutions, take action, and very importantly, evaluate the action. Evaluate the outcome of your actions. And if upon evaluation, the patient is not improving, what do? Start afresh. Recognize cues, analyze cues, prioritize hypotheses, generate solutions, take action, evaluate outcomes. If you practice answering questions in this order, you would notice a significant improvement in your performance. The problem is that most NCLEX candidates jump from cue to action without analysis, and that's where you lose a lot of points. Basically, merely attempting thousands and thousands of question banks might not suffice, because in addition to volume, you need to review patterns, review the rationales deeply. You need to categorize your errors. You need to spot your weak points and improve on them. High performance students will always track recurring traps and focus on weak systems strategically. Quality of studying will always beat quantity. So you can join our NCLEX Academy. Most prep platforms give you large question banks, performance percentages, general rationale. What they don't teach early is pattern recognition. But in our academy, we break questions down into recurring decision frameworks. We train you on prioritization. We teach you to recognize lab triggers. We drew you on NGN clinical judgment sequencing. And then in 3 months, you could have covered everything, every system that NCLEX tests you on. So this is not just practice. We're telling you why certain answers repeat. And that's the difference between hoping to pass and preparing to pass. If you remember nothing else, remember that NCLEX is predictable, and not because the questions are repeated, because the decision patterns are repeated. Once you train your brain to recognize oxygen threats, acute changes, safety violations, lab red flags, delegation boundaries, and clinical judgment flow, the exam becomes very manageable. So if you want a structured program that teaches these patterns step by step, instead of leaving you to figure them out alone, our NCLEX Academy is viewed exactly for this purpose. We also focus on the success of internationally educated nurses. So more than content, you need clarity, and we train you on clarity. If you want to enroll or reach out to us, click the link on the description box and see you at our next lecture.